My name is Dr. Abbas Naqvi. I'm one of the orthopedic surgeons here at Town Center Orthopaedics. I've been with the practice for a little over a year now. I'm fellowship trained in adult reconstruction and do a lot of trauma care as well. What that means is, for the most part, I specialize in hip and knee replacement, as well as revision hip and knee replacement, meaning if you're having trouble with an already replaced hip or knee. So what adult hip dysplasia essentially means is that the hip was not formed appropriately in utero. What this results in is you having kind of a shallow socket where your hip is not fully captured. And that shallow socket leads to an abnormal movement of the hip that will eventually lead to wear and tear in the development of arthritis. The classic symptom that patients will come in complaining of is pain in the groin, which may sound unusual to most patients because, we imagine our hips in this society to be much higher because we measure hips across the pelvis. But in reality, our hip is located in the groin, and that's where most patients will feel pain, especially when they flex their leg up, as if you were trying to touch your knee to your chest. That is probably the most common complaint that we see. So if hip dysplasia goes untreated, that abnormal motion of the hip, as we mentioned earlier, will go on to cause arthritis of the hip. And that arthritis will typically cause pain in the hip. As I mentioned earlier, that pain is typically felt in the groin. And it's usually worsened by things like flexing the hip up, like when you try to touch your knee to your chest, or sometimes even rotations of the hip, such as when you're getting into a low car. So adult hip dysplasia treatment is divided into two broad categories, essentially. If we catch the dysplasia early enough, such that there is no arthritic change in the hip, sometimes what we can do is break the bone around the hip, what we call a periacetabular osteotomy, to try to shift the pelvis to cover that hip a little bit better. However, if you've already started to develop arthritis in the hip, the next step is going to be a surgical procedure to replace the hip. The reason for that being is that when arthritis sets in, the cartilage has worn away, and unfortunately there isn't a treatment that can bring the cartilage back. As a result of that, we end up replacing the hip. As you can see in this model right here, we replace two parts of the hip. One part is the socket that becomes arthritic. We actually reshape that socket and replace it with a metal cup that will grow into your own bone and become your own. We also go on to replace the hip, as you see here. We size the bone appropriately for you and replace it with an implant that your own bone will grow into and will become your own. The two combined create a pain-free articulation of your hip, so much so that most patients go on to forget that they even had a hip replaced. So I cater my approach to developmental hip dysplasia based on how far gone the patient is. Again, if they're in the earlier stages of hip dysplasia and their hip is pretty pristine, we can think about non-operative modalities, things like physical therapy, anti-inflammatories, maybe even steroid injections. And if the anatomy is appropriate, we can even consider procedures like a periacetabular osteotomy, where we try to break the bone and cover it around the hip to improve the coverage. However, if patients go on to develop arthritis of the hip and the non-operative treatments are not providing the kind of pain relief that you're looking for and not allowing you to do the things that you enjoy in life, like go for walks, hike, play with your kids, etc., then the next step would be surgery, and that would be a total hip replacement. Now, I like to do my total hip replacements through a minimally invasive anterior approach, which I think provides less pain, a lower dislocation risk, and certainly faster recovery. Well over 95% of the time, this surgery is actually outpatient. You're up and walking on it within an hour of coming out the operating room, and you usually go home the same day. Unfortunately, hip dysplasia is a mechanical problem. It's a malformation of the hip. There aren't really any lifestyle modifications that can alter that anatomy or slow down progression of the disease, but there are certain lifestyle modifications that can help to alleviate pain early on. There might be certain activities that you have to scale back on, especially activities that result in a lot of jumping or flexion of the hip. But outside of that, there's very little that can be done from a non-surgical perspective to really restore more normal anatomy to the hip in the setting of hip dysplasia.